What is an EMR? The term literally stands for Electronic Medical Records. Remember those thick files and folders that were available at the hospital that were huge, large, and had sheets and sheets of paper inside? Every single doctor, every single nurse had documented something, had written notes, and they were all flying around. Well, that is what was made electronic. They wanted to digitize the patient chart. So the patient chart and everything in it would be digitally available in the form of electronic medical records. If an EMR just stands for electronic medical records, then what is an EHR? They expanded the term. They just didn't want it to mean medicine, but they wanted it to mean proper healthcare. So it was expanded to be made EHR or electronic health records. Nowadays, electronic medical records and electronic health records, these two terms are used interchangeably. They really mean the same thing. Whatever's happening with the patient, their social life, their family history, in case they visited something which is not with the physician, maybe with the physical therapist, maybe just, with a psychologist for some counseling or anything remotely related to health, was documented in an EHR in a digital manner. So it just meant that you were computerizing everything, and every single paper aspect of the patient chart and everything that happened with the patient in a hospital was available on the system, in a computer, in the form of files and softwares. To make that happen, lots and lots of things had to be done. How did all this start anyway? Did hospitals just wake up one day and say, oh, we want to computerize everything? Not really, guys. There was something called the HITECH Act, and it was part of the American Recovery Act. It just meant that hospitals who were computerized or were digitized were given incentives. Even more important than incentives, if they had reached a certain level of computerization, then they could avoid certain penalties. Even more so than having incentives, if the hospital had reached a certain level of computerization or digitization, they could avoid certain penalties. There was an organization called HIMSS that was set up just to stage hospitals in terms of their computerization level. So there was stage 1, stage 2, stage 3. Stage 2 being better than stage 1. And if you had achieved stage 7, stage 6, or anywhere there, hospitals talked about it really, really proudly. It was something that they wanted in terms of computerization, software systems, being able to follow the HITECH Act, being able to be computerized, and also being able to bill with CMS, the Center for Medicare and Medicaid Services. A lot of the hospital billing in the US went through CMS, and CMS demanded that a lot of things have to be done digitally, which just meant that hospitals had to follow. So were you just supposed to buy this EMR and just get it at your hospital and start working on it? Everything just turned into computer overnight? No, guys. It took months and months of work to do the implementation. Hospitals planned for it very, very diligently. If they were on paper, then they made sure that they go onto a system so that paper and systems were available 24/7 or at least for a large period of time, so that they had a backup in case things went wrong on the implementation date or the go live date. Even to get to the point where they could start documenting physician consultation or what medications physicians had prescribed for the patient took more than a year's work. You were setting up the software system. You were looking at the workflows. You were seeing how many physicians or patients or nurses or physical therapists or respiratory therapists needed a login into the system. Just to create those things, just to make sure softwares were working, that we had the screens to document, and we had it in the manner which was hospital specific, which basically means that you were customizing. All that took time. So say about a year. It took about a year to get there and ensure that we were there. And after that, the hospital would plan a big go-live date. It would say that we're going live on 29th October, such and such year, and we stop using paper. There were always leftovers. There were always loose ends to tie. So we continued using paper in some cases, or the older system that the hospital had in some cases, for a couple of months till the full and complete transition happened. So who are these big names in the EMR world? There's Epic, there's Cerner, NextGen, Intercom Plus. There are tons and tons of names. InterSystems is another one that comes to mind. They really are the big players all over the world, not just US and UK, but they're expanding to many countries in Europe and some Asian countries too that I've heard of. It just means that they have lots and lots of computerization in the medical world. They have data, and they can use this data to do things better and better. So was all this effort worth it? Why pay millions of dollars to get an EMR system or a computer system when you were on paper or an older system and it was running somewhat okay? This was worth it, guys. It was a lot of effort, but think about what all you could do with it. You could track patient data. You could document such that nothing would get lost or torn or burnt, or something that fell in water you couldn't access again. If you were seen by one physician on week 1 and somehow 2 weeks later you had another appointment, but that particular physician had a day off, the second physician could see what the previous physician had documented. It was all there in the system. You could go back years and years, not just one consult, but you could see it all. It's really power back into the hands of the healthcare providers and the patients. The patients got a login too, and they could see what all they had done, the physicians and the nurses they had visited, if they had had hospital admissions, if they need medications, what medications now need refills. So it was power back into the hands of the people who were part of the healthcare system and the people who were patients themselves. It was truly worth it. How did all this benefit the patient? It made an enormous difference. They could schedule appointments easily. They could just go online and schedule it or make it with a phone call. They didn't have to physically go in to the clinic just to make an appointment for the following week. If they needed flu shots, reminders were given and pop-ups would come up on the system, so that it made it easier for the healthcare providers to actually call them and say, hey, Dr. Smith, Mr. John Smith, your flu shot is due. Why don't you come in? The reminders, the telling them what to do next, which is appropriate, made it easier. Within the pharmacy software, it made it very easy for the technicians to actually see the pop-ups for different patients and then call them and remind them, saying your diabetes or your cholesterol medication is due. Please don't forget, please don't miss doses, please come and get it. If a patient got surgery and he then needed physical therapy, the system will actually remind you and suggest it, saying, hey, can we suggest physical therapy? Would that be appropriate? And then it made it less likely for the physician to forget. I'm not saying physicians generally forgot. I'm just saying that it made it easier to standardize care and ensure that a lot of people got a lot of good things and they got it on time. As I said before, it gave power back to the patients. In this big healthcare IT world, I am a pharmacologist that works in the IT department. I work on a variety of things, on pharmacy work, on oncology work, and I design various chemotherapy protocols with the help of our pharmacotherapy specialist and our oncologist. It's really very, very gratifying work. You feel blessed to do all these things. Do I support all these big implementations? It's really done a lot. It's integrated and intertwined the entire hospital. I can see what's happening in a different department with the same patient, and I know exactly what is going on. I can see follow-ups, and I see that a lot of follow-ups are now not missed. So now are we all done? We're done with go-lives, implementations. We're done with Stage 7 HIMSS staging. We've got awards for all these technologies that we've implementation. No, guys, we're not done. All these companies are now using AI. AI has entered medicine and they are coming up with a lot of predictive models which can benefit the patient. You can use genes and predictions, and with all this data that you have, you could probably predict who needs more testing and preventive testing and who doesn't. Who is predisposed to a particular condition and can we avoid it? Can we prevent further grief? In one of the big studies, which was enabled by EMRs, we could stop patient admissions. We could say that for certain things, patients don't have to be admitted at all. It meant less cost for the patient, less cost for the hospital, and overall better outcomes for the patient because they went home. They went home and got better in a nice environment called the home. Really, guys, it's way better when you're at home. We could also reduce admission stays at the hospital by tracking data in our EMR systems. We could see that if something is done in 4 days, can we do it in 3 days? Again, patient spends less, hospital costs are less, and patient outcomes or how the patient recovers is way, way better. We did well, guys. There's more to do with AI and all the predictive models coming up, but I do think healthcare IT has come a long, long way. I hope that you support this healthcare IT system. Thank you so much for watching.